Welcome to STEM at Home with Newton's Road for 6th to ninth grade students. We're so glad you were able to come today. This is your chance to learn from some experts in our region and from each other as we continue to learn at home. My name is Barb Tremont, and I'm the Executive Director of Newton's Road, a regional nonprofit supporting STEM learning and career exploration. I also have with me today our Michigan Tech University intern, Annalisa Wiesner. Hey, hello, Annalisa.
Hi, everyone. Hi.
We also want to welcome our special guest today, Debbie Kerner. She works at
Hello.
Muncie Medical Center.
Hello.
If you can turn to the slide about Debbie, please, Annalisa, that would be great. Thank you. So as you can see here, Debbie works at Muncie Medical Center, and she's the manager of the respiratory care area at the hospital. She's a longtime resident in Benzie County. And she, while she's the manager now, she has worked previously as a registered respiratory therapist that we're going to learn about today, as well as a specialist in neonatal with infants. And she has an associate degree in respiratory therapy and a bachelor's degree in business administration. And previously, I just mentioned those other areas, including a clinical coordinator. Thank you so much for coming and joining us today, Debbie.
No problem.
So this session is being recorded, and it will be available after our live presentation on our Facebook Live page, along with all of our other past programs, and on our Newton's Road YouTube channel. So since we do not have any participants in the Zoom today, we'll just welcome all of you who are out there with the Facebook. And please, if you have questions for Debbie as we're going through this presentation, or for the Newton's Road team, please use the comments area on the Facebook Live page, and we will read your questions to Debbie live and answer them live. Okay, so next I'm going to share a little bit about Newton's Road. In 2020, we are celebrating 10 years of working to ensure that all kids in our 5-county region have access to quality STEM learning and career exploration opportunities that will help you to become great problem solvers. This is our homepage. So if you are ever wondering what's next on our STEM at Home programming or a lot of other resources we have, this is where you come. And this alert will take you directly to our STEM at Home events calendar. And so here you get all of the login information that you would need to join instantly on the session with one click off of our home page. If we go back to our home page and you scroll down toward the bottom, you will see a link to go to our mailing list. This way you would sign up and you will get a newsletter once a month about all the new things that are happening, celebrating winners of contests as well that have already occurred. And a lot of other information for parents, youth, and businesses around STEM learning and education. Also, the calendar has events that are held by Newton's Road and by other STEAM maker organizations in our region. There's you can sort it by things that are live by any of ourselves or our colleagues, or also you could do ones that are available to do anytime. So like anytime science activities you see there, like in that third row, cup rocket launcher, create a cup tower, you know, so these are all different activities that you could do anytime that are related to science and STEM. So thank you so much for that demonstration, Annalisa. And we're going to get right back to Debbie. I can't wait to learn more about what a respiratory therapist does and how you can prepare for this career. Again, I'm just going to remind, if you have any questions, please put them in the comments area on the Facebook Live or in the chat or Q&A if you join us later in the Zoom. Debbie, it's all yours.
Thank you. A respiratory therapist, as you can see, is a professional who's trained to help people who are having breathing problems. We can help patients who are having a sudden problem, which we call an acute breathing problem, or other patients, we help them with a long-term or chronic pulmonary disease. Could I have the next slide? So what does a respiratory therapist do? We do a lot of different things. We administer oxygen, and there are a lot of different breathing treatments that we can give patients to help them with their breathing. We're part of the emergency response teams in the hospital. That includes the CPR team, our medical response team. If someone is having an issue, they call for help. We are the professionals who set up and adjust the ventilators for patients who need help with their breathing. We also set up and manage various respiratory monitors, and there are a lot of different monitors we can use to manage and watch how a patient is doing with their breathing. We also draw arterial blood samples and analyze the results. That's a special type of blood test that measures oxygen and other gases in the blood, and you can tell a lot how a person is doing with their breathing by looking at the arterial blood samples. We also have respiratory therapists that are specially trained to do pulmonary function testing and trying to figure out what type of pulmonary problem somebody is having. Also, we provide a lot of different types of patient education, and we also do something they call pulmonary rehabilitation, and that is really a combination of education for people with chronic breathing problems and also a supervised exercise program. Just like anybody, if you exercise, you become healthier. So we can help patients who have chronic pulmonary problems get healthier by doing pulmonary rehabilitation. So next slide. These are examples of some of the different types of equipment that a respiratory therapist would use. These are in the hospital. The first picture you see is an infant oscillatory ventilator. That's a special kind of ventilator. A lot of times when babies are born too early, they have problems with their breathing. Their lungs aren't fully developed. And there's a lot of different types of equipment we can use to help them with their breathing, and an oscillator is just one of those things we can use to help them. The middle picture is a picture of an adult ventilator, and this is what we would use to help an adult patient who is having problems and needs to be supported with a ventilator. And the last picture is a picture of a couple of infant transport isolates. Respiratory therapists quite often are members of the neonatal transport team, and we can go and pick up babies from other hospitals and support them while they bring them back to our NICU so that they can get the extra special care that we can provide in an NICU. There's a built-in ventilator in that isolate. There's all the monitors, IV pumps, and other equipment we need to keep the patient safe while we're transporting them. So next slide. Here I think we have a video to show you.
How do we start CPR taking a pulse?
Really never a boring time when you're trying to become a respiratory therapist. Meeting about 20 one day, including myself. And we're for that type of big life event that happens. And
So go ahead, get that tongue pushed out of the way.
A respiratory therapist is someone who specializes in evaluating, diagnosing, and treating patients with cardiopulmonary disease or diseases of the lungs and heart. In the classroom, we focus a lot on simulation. So we have human patient simulators, which we can set up to do exactly what a patient's going to do in the hospital. So the first time you do some invasive procedure or something that really does have a negative side effect if you would do it wrong, we can do it in the classroom, and if it doesn't go how we expected, we can push reset and restart it without having any damage done.
You know, we have patients trying to
Right now, the job outlook is magnificent. The U.S. Bureau of Labor and Statistics' latest poll, I guess if you will, said that there is a 19% job increase expected over the next 7 years, which equilibrates to about 23,000 new jobs nationwide. So the students are getting hired when they graduate.
Going down into the heart.
This is really something I will be happy in doing.
His diaphragm looks.
I made the right decision.
Okay, so where does a respiratory therapist work? There's a variety of settings, but a lot of the respiratory therapists work in hospitals, and we see patients in pretty much all areas of the hospital, including the emergency department. We treat patients who are having breathing problems there. We are very involved in all of the adult critical care units, and that can include the intensive care unit, the coronary care units, cardiothoracic surgery units, and other adult critical care areas. We also take care of pediatric and neonatal patients, and that can include pediatric intensive care units or neonatal intensive care units. Sometimes respiratory therapists are on the transport services, and that's moving patients from hospital to hospital. And we can do the coronary care unit. We can do that and ventilate them during the transport. We're taking care of patients throughout the hospital in the general adult and pediatric nursing units. And again, pretty much all areas we can provide care to patients in the hospital. Next slide. Therapists sometimes are employed in outpatient clinics or doctor's offices, but also these can be outpatient departments and hospitals. They can perform pulmonary function testing, which is a specialty within respiratory. There are pulmonary rehabilitation programs. Again, that's done on an outpatient basis. And patient education programs, smoking cessation in addition to breathing classes for pulmonary rehabilitation and other programs. Some subacute and long-term care facilities employ respiratory therapists, in particular if they have rehabilitation units that specialize in weaning patients from ventilators, or long-term care facilities that specialize in keeping long-term ventilator patients. Next slide. There are respiratory therapists that are employed in home care and durable medical equipment companies. There are a lot of patients that receive oxygen at home. It is also possible for a patient to have a home ventilator and be able to be at home in spite of the fact they need help of a ventilator. And there's various types of home respiratory therapists that a therapist can help with too. There are respiratory therapists that are in colleges and universities teaching students to be respiratory therapists, so you can be a clinical instructor or a program instructor for a respiratory program, and also in the military. Next slide. What might you be interested in respiratory? If you enjoy helping people, this is definitely very rewarding if you like to help people. If you enjoy working in an exciting, fast-paced environment, it can be quite busy and you have to be able to think on your feet. If you enjoy working as part of a team, we are part of a team. My respiratory therapists cover the whole hospital, and they do work as a team to make sure we are able to take care of all of the patients. They also become part of the team on the nursing units that they work on. So it's very important to be a team player. And if you're interested in science and technology, you might be interested in respiratory therapy. We use a lot of science, and we use a lot of different equipment that uses various types of technology. Here at Munson, we have an affiliation with Muskegon Community College. students can take some of their classes from NMC that can transfer to Muskegon, and they actually get their degree from Muskegon in respiratory therapy, but they're able to participate in the Muskegon classes by video conferencing right here on site at Munson. There are a few requirements that you have to go off campus to complete, but the majority of the program can be done on site. Next slide, please. And if you'd like more information on what a respiratory therapist is and what is required, you can go to the American Association for Respiratory Care website. And under careers, there's a section of what is an RT. There's various videos to give you an idea of what a respiratory therapist does. It might give you an idea if you would be interested in that type of work.
So we are open for questions, and again, we'll start asking some questions, but if you have some more to ask, you can ask them on our Facebook Live using the comment section. And if you join us in the Zoom, which you can get to from our STEM at Home page on our website, you could do the Q&A or chat function. So Debbie, could you, these days when we're in this pandemic with the coronavirus, and I understand that the way it comes into our body is through our respiratory system. So what has this meant for this career family? What has been the impact of being in this pandemic?
Well, as you've probably heard in the news, the use of ventilators has really increased. And actually, more people are aware of ventilators and what they do for patients. The increase for respiratory therapists occurred. The more patients being ventilated, the more you needed respiratory therapists to help with setting up and managing those ventilators to take care of the patients. But it wasn't just ventilators. Just any oxygen delivery, specialized heated high flow oxygen is used quite a bit for the COVID patients. That's been found to be very helpful. So there are precautions that we have to take, though, in taking care of the COVID and the suspected patients. So that has changed a little bit, too.
I have a question. I'm wondering, Debbie, what percentage of your time as a respiratory therapist is spent with people, and what percent of your time is spent using machines and technology?
It's really interfacing the machines and the technology to the patients. So you're actually caring for patients. There is some time away from the patients in preparing the equipment, and we also, we might be using a computer to look up orders and document our care. Most places now use electronic medical records, so you have to be comfortable with that. A lot of times our equipment can interface with those electronic medical records too. So, but it's really interfacing the technology to taking care of the patient.
Thank you. We do have a question from a viewer asking, how much do respiratory therapists in our area typically get paid?
That is dependent on how much experience you have. I think the starting wage is approximately $20 an hour, but I'd have to look that up to answer that accurately. But.
And they also ask, what other careers can respiratory therapy lead to?
A lot of people start out in respiratory. I have had respiratory therapists who have gone on to be instructors for college. I've had respiratory therapists. I know of more than one respiratory therapist that has gone into information systems or clinical informatics. Again, we use a lot of computers in our profession, and so they get very specialized with that technology. And it's actually a good resource for us when the people working in the information systems understand the work that we do.
Mm-hmm.
So,
We have another question.
great.
Can you choose to work just with kids or just with adults?
It depends on the hospital that you work at. Some of the larger tertiary care hospitals, it is possible to work full-time in the, say, neonatal intensive care or the pediatric intensive care, but that's usually a larger hospital that specializes in pediatric care.
So does that mean that in one day you might be, if at a smaller hospital, you might be working with infants and with adults and with elderly adults as well?
Yes, it's typical for respiratory therapists to maintain the skills of working with all ages of patients and in all areas of the hospital. But you can be specialized if you get into the larger tertiary centers. I was previously employed full-time in an NICU when I worked in North Carolina.
Mm-hmm. So if someone was interested in doing this, you mentioned, science and technology. What kind of classes would you recommend that they take in school if they're in middle school or high school?
Science classes, you have to have a basic math for the various calculations. Science, I would say physics, including the gas laws, are very important. You have to understand the gas laws in order to understand how you're ventilating your patient and making adjustments with the ventilators.
Okay, so, and then in the sciences, the biology, is
Biology
chemistry.
and anatomy and physiology, microbiology is important.
Mm-hmm. Is there any other resources that you think it would be? Oh, we have another question that just came in. How long does it take to become a respiratory therapist?
Entry level right now is an associate degree. It typically takes a few prerequisites to get into a respiratory program. So typically it can take about 3 years to get your prerequisites done and then enter the program, and most associate degree programs are about 2 years in length. Right now, an associate degree is entry level for the profession, but we are moving towards, and I'm pretty sure at some point it will require a bachelor's degree. That's a ways away, and there are bachelor programs available for respiratory care, but typically now people complete an associate degree and then pursue their bachelor's once they're in the profession.
Mm. And is there financial support to do that?
Most hospitals have some type of tuition reimbursement that helps you out with that.
Great.
But one of the things you need to remember, though, about going into respiratory therapy, the majority of the jobs are working in the hospital. We're very similar to nursing in that we provide care 24 hours a day, 7 days a week. So you are working all shifts. You're working weekends. You're working holidays because Um, Sick people need to be taken care of around the clock. We work very closely with the nursing staff at the hospital.
Can you have a traveling job as a respiratory therapist?
Oh, yes. There are therapists that do travel assignments just to experience different areas of the country and also see the different hospitals.
And then locally, again, the schools, you can do the preparatory classes that you mentioned. You can do that at NMC, but inside Munson, you can access the program to Muskegon Community College. That's particularly around respiratory therapists. Is that right?
Yes, they would need to reach out to Muskegon Community College to find out what the requirements are. Some of the students actually are attending some of the NMC classes while they're in the Muskegon program, participating with that. But they would need to talk to the program director about what the requirements are and how to plan for completing all the required classes. But some of them can be done through NMC. The respiratory portion, though, does have to be done through Muskegon. And our classroom is just down the hallway here for them.
Where did you get your degrees, Debbie?
I attended North Central Michigan College in Petoskey. That was many, many years ago.
So in regard to, back to the COVID area, so do you see that, having these kind of newer illnesses, is that something that's going to increase the demand for respiratory therapists, that we're going to need more of them?
I think definitely yes. I do think we'll have to see how this plays out. But if there's going to be more ventilator care required, they will need more respiratory therapists.
Well, thank you to you and your staff who are on the front lines of helping out in this new world we're living in.
Thank you.
And we really appreciate your time coming to us today. If anyone else has a question, you can enter it in the comment section on Facebook as we wrap up the call. And if we had any more time, we can go back to that. But I just want to thank you, Debbie, for joining us today. And I want to thank our sponsors and supporters who make STEM at Home with Newton's Road possible. And I wanted to share with you some of the upcoming events that we have as well. So this week on Thursday, we have 2 programs, STEM at Home for K through 5th grade from 2 to 2:30. And that will be with Cognition from Benzie County. And that afternoon, we will have STEM at Home for 10th to 12th graders, where we will learn about accounting and analytics type careers. And next week, Tuesday, 1 week from today, we'll have a parent coffee break where parents can come and ask questions around teaching at home and what are some resources available for youth of K-12. And of course, we'll have this program again next week at this time where we'll be exploring IT. What is IT, Internet technologies, and learn about those careers. So thank you for joining us today, and we look forward to seeing you again. Bye for now.
There we go. And it looks like we're off air now. Do you typically stop the stream at this point?
Yes.